Hello and good afternoon. My name is Deontay J. Marquis, and I am a family nurse practitioner and registered nurse in Southern California. And today, as you probably can see, we will be discussing an introduction to hypertension. And this presentation is brought to you by myalftraining.com. So, without much further ado, let's begin. Okay, so our first slide here, as you can see, I like to outline the course objectives so you can better understand what we will be discussing today and what you will be learning about. So, first course objective for today is by the end of this course, you will be able to understand and define hypertension and how it presents. So, you will understand exactly what hypertension is and also how it will present in a patient who doesn't have hypertension and hasn't received the diagnosis, and also for patients who have and are currently managing their life with hypertension. Our second course objective for today will be able to recognize and identify hypertension by the diastolic and systolic values as well as patient symptoms. So we will understand the values that are associated with hypertension and the different levels of hypertension, pre-hypertension, hypertension, stage one, stage two, so forth, and also what symptoms we can expect from the patient as we transgress through each of those levels of hypertension. Third course objective for today, you will be able to recognize common hypertension medications as well as their side effects. So this is very important because so many individuals in the US are struggling with hypertension and taking different types of medications to treat different types of hypertension and other comorbidities that they may have. So we want to know what those medications are so we can understand their side effects and we can be able to treat our patient accordingly. Our fourth course objective for today, you will be able to demonstrate knowledge to recognize and ability to manage hypotension as a result of those hypertensive medications. So, hypotension is a side effect of hypertension medications, many of them, so much so that I gave it its own bullet point here as a course objective because I want you to be able to recognize and manage hypertension, which is one of the most common side effects of hypertensive medications. You need to be able to respond and react appropriately when a patient becomes hypotensive as a result of taking medications. So we'll go over that today. And we have a lot to go over today. As you can see, we're on our fifth course objective here, which is you will be able to recognize the signs and symptoms of a hypertensive crisis and recommended treatment options. So, a hypertensive crisis is a very, very serious uh, level of blood pressure that has risen to heights that endanger the patient's life critically. So we need to know how to recognize hypertensive crisis, what it looks like, and of course, we need to be able to understand what treatment options the doctor might order, which will help us understand what our next move will be in preparing to treat the patient and notifying the doctor and what to expect, and to give that information to our patient. Next course objective, you will be able to implement non-pharmaceutical interventions to help manage the patient's blood pressure. So after learning about all those medications, learning about their side effects, how they can affect the patient, what we're supposed to do, now we're going to focus a little bit on non-pharmaceutical interventions and ways we can manage the patient's blood pressure, which is very important now because patients sometimes are non-compliant or they don't want to take their medications, or maybe they're trying to wean off their medications and they want to finally fully commit to the diet, the lifestyle, a healthier lifestyle, and they want to also manage their blood pressure without the medications that they've been taking. Also, we're going to discuss dietary restrictions to be followed for patients with hypertension. There's a specific type of diet that these patients need to abide by, and we're going to delve deep into that, the specifics of that diet today as well. And last but not least, our course objective for today will be understanding how hypertension can lead to sudden serious health conditions, such as a stroke, which is a very serious health condition, and also how to recognize when a stroke might be impending because the patient's blood pressure has risen so high, and how to handle these emergency situations. So, we have a lot to learn today. Have some great slides prepared for you, great presentation prepared for you. So let's begin. So, first question in an introduction to hypertension presentation, of course, is what is hypertension? So, it's quite simple, and you probably already know, but we are going to read this together. Hypertension is blood pressure that is higher than normal. Your blood pressure changes throughout the day based on your activities. But when you have hypertension, your blood pressure is higher than normal. So you're probably asking now, well, what is considered a normal blood pressure? A normal blood pressure, and these values in my research vary from about 10 millimeters per mercury, depending on the website that you go to. So these are not set in stone, but rather a compass to guide you in knowing what's normal, what's elevated. So we'll treat them as that. So what is normal? Normal is when the blood pressure is less than 120, the systolic, which is the top number or the upper number on the blood pressure. And the diastolic is the bottom number on the blood pressure. And that number, when it's normal, is less than 80. So a normal blood pressure would be 110 over 60. That's a normal blood pressure. For someone who's an athlete or who runs a lot or exercises very often, their blood pressure might pump more, their heart might pump more efficiently. So their blood pressure and their heart rate will be lower than normal. So you may see someone's athletic, plays high school or college sports, then their blood pressure would be something like 90 over 58. Those are considered normal. Those are considered normal blood pressures. Having blood pressure measures consistently above normal may result in a diagnosis of high blood pressure or hypertension. So when we say above normal, you see here we have this section in yellow that says elevated. This is above normal. And this would be considered actually a part of the pre-hypertensive stage. Um, the orange section here would also be considered the pre-hypertensive stage. And I'm speaking to you from a more clinical setting. Um, Patients with a blood pressure that's over 140 would indeed be considered hypertensive, especially if their blood pressure is consistently above 140 or above 90 diastolic. Now, this would indicate to the healthcare worker, be it a doctor, a nurse, or a medical assistant, that the patient has hypertension, because even when they're sitting down, resting without any movement or exercise, their blood pressure is elevated. So that is our introduction to what is hypertension. Now, here are some more values for you just to illustrate uh, what I said, that these numbers aren't set in stone, but rather compasses to guide us to know where our patient is falling at. So you'll see here, normal is less than 120 and less than 80. Here, we find the same. Pre-hypertension, 120 to 139 and 80 to 90. So see, 120 to 139. This slide combined the previous slides, two categories, to a pre-hypertensive stage, just as I said. Now this, I'm more lenient towards this chart of numbers because it is recommended to us and provided by the American Heart Association, the AHA, while this was taken from a medical journal. So for the purposes of this presentation, we will go by this slide, these numbers and values for blood pressure and the different categories. And also I want you to know that these are the numbers that I go by as well in my practice. So as we can see, high blood pressure is 140 to 159 systolic, or diastolic 90 to 99. High blood pressure or hypertension stage 2, this is someone with their blood pressure who's consistently high, who probably needs medication, hasn't been officially diagnosed because they haven't visited a doctor, or someone who's just stopped their medications, or their medications are no longer working to keep their blood pressure low. With medications, your patient should not have a blood pressure of 160 over 100. Their blood pressure should not be 140 to 159 over 90 to 99. Their blood pressure should be closer to normal. At worst, it should be pre-hypertensive. If you find that their blood pressures are consistently in the high blood pressure or orange column, or the high blood pressure red column, then you should notify the doctor or the nurse, because this is an issue and needs to be resolved. So last column on this chart would be our hypertensive crisis emergency stage. And as we can see, the blood pressure here are extremely high, 180 plus over 110 plus. So we will discuss hypertensive crisis and emergency stage later on in this presentation, but I wanted to introduce you to those values, for you to remember those values, this slide, and these numbers as we progress later in our presentation. Let's continue. So now that we know what hypertension is, we also want to know what causes a patient to develop hypertension. Why are their numbers consistently high? What's going on inside of their body that's causing this? Well, we know that high blood pressure is caused by several factors. So there are several things that could have affected them, or that they did or didn't do, that have led to them developing hypertension. So these things include smoking, living a sedentary lifestyle, being obese, having high cholesterol, significant amount of stress over a prolonged amount of time, their race. Race also has a strong factor in determining individuals who have hypertension. There's a positive correlation between African Americans and Hispanic Americans and hypertension, and a significant disproportion in relation to other races. So race plays a large issue in hypertension. Also, age. Individuals who are older, of course, are more prone to developing hypertension, and family history. If a patient's mother and father had hypertension, it is more than likely that they too will develop hypertension at some point in their lives. And as we can see, I included this diagram here to illustrate the difference between normal blood vessels and blood vessels of a patient who has hypertension. So, as you can see here, this pink sphere would be a blood vessel. And these red small dots here would be blood cells moving through the blood vessel. So here we can see the diameter of the blood vessel is much wider, just about double the width or circumference of the opening here in the blood vessel of the patient who is hypertensive. So what does this tell us? This tells us that there is an increased resistance or more force that needs to be exerted by the heart to push blood that is needed for the rest of the body through the blood vessels. So that means that there is more pressure inside, because there's more force needed to push these blood cells through the blood vessel because of the reduced diameter. So what caused this blood vessel to become thicker and decrease this hole? Well, that would be the several factors here: smoking, high cholesterol, stress, race. All of those things played equal parts in thickening of the walls of the blood vessels. High cholesterol leads to atherosclerosis. And we know, or may not know, that atherosclerosis is a big fancy word for a buildup of plaque. So there's a buildup of plaque from smoking, from not exercising, poor dieting, or maybe this patient's family history that the family just has blood vessels that are thicker at the walls. And this patient didn't live the perfect lifestyle, so now they have developed hypertension. So that is what you can imagine their blood vessels look like. High blood pressure is a huge issue in America, of course, because of the rising levels of obesity, the sedentary lifestyles, and everything that's going on with our health system. Um, but more specifically, because hypertension is a silent killer, and oftentimes individuals who don't go to the doctor or who haven't been to the doctor in a long amount of time have no idea that they're suffering from hypertension because they don't have any symptoms that are specific to hypertension. Now, a patient who has hypertension, they have recognized those symptoms as such, and those symptoms that they may report to you if their blood pressure is high and they're taking medication to keep it lower. Some of those symptoms might include a feeling of pounding in their head. So they may have pounding in their head, a really bad headache, or they may be complaining of chest pain, really bad chest pain, or pounding in their chest. Uh, the patient may also report a feeling of lightheadedness or dizziness. So, patients who have hypertension, if they report that they're feeling lightheaded or dizzy, we know that the blood pressure is elevated. There's a lot of fluid fluctuation or the body trying to compensate when they stand up for the movement of the blood in the body, and the heart having to pump harder to now push the blood through the body when it's standing. So they may feel lightheaded as their heart catches up. They may feel sudden fatigue or drowsiness if they have hypertension. So these are all key symptoms that we want to keep an eye out for, because if the patient calls and reports one of these symptoms, we know that they're at an increased risk for a fall. So we want to make sure that we help them and we check on them and we check their blood pressure and we get it back to a safer level. Now, getting a patient's blood pressure back to a safer level, how can we do that? Well, we can achieve um, a reduced or lower blood pressure for our patient through giving them medications, of course. That is how we treat many diseases, with wonderful medications that can help counteract the effects of a disease. So, hypertension is a disease, and we counteract or correct our blood pressure using diuretics, beta blockers, or calcium channel blockers. Now, diuretics, these medications act on your kidneys. So they work on your kidneys. They have nothing to do directly with your heart or your cardiovascular system. Instead, they work on your kidneys. And what do? They pull out sodium and water, thus reducing the blood volume. So they decrease the volume of blood. And now, where the heart is then able to uh, reduce its work to push the same amount of blood cells through the blood vessels, because there is less blood volume, because we have reduced the amount of water and sodium that's being transported through the blood vessels in our blood. Okay? So, some examples of diuretics that are commonly used that you may have seen, may have heard of, or may have given. These medications include bumetanide, which is more commonly known as Bumex, furosemide, which is more commonly known as Lasix, and hydrochlorothiazide, which is more commonly known as Microzide. So, diuretics, most common medications, Bumex, Lasix, and Microzide. And they don't work on the cardiovascular system to reduce blood pressure. They work on the kidneys, and they pull out sodium and water. Not potassium and water, sodium and water. Beta blockers is a second very common pharmaceutical intervention that we use to manage a patient's blood pressure. And how do these medications work? Well, beta blockers work directly on our cardiovascular system by reducing the workload on the heart, by opening up our blood vessels, which causes the heart to beat slower and with less force. So, why would we want to open up our blood vessels? Well, you remember this diagram that I showed you. And here, the patient is hypertensive, and we see that their blood vessel is closed, where the blood passes through. It's much more smaller in diameter than a normal blood vessel. So, it is very beneficial to us to take beta blockers, which are going to act on our blood vessels, open them up, which allows our heart to beat slower and with less force, and thus will decrease not only our heart rate, but also our blood pressure. Now, what are some common beta blockers that we may give to our patients? We may see them taking. These medications would include metoprolol, which is commonly known as low pressor, atenolol, which is commonly known as tenormin, carvedilol, which is commonly known as Coreg, and also propranolol, which is commonly known as Inderol. Now, you may notice that all of these medications, except for one, ends in OLOL. And the one medication that doesn't end in OLOL still ends in LOL. So, beta blockers, if the medication is a beta blocker, 9 times out of 10, it ends in OLOL. And how does it work? It works by opening the blood vessels, allowing the heart to beat slower, and decreasing the amount of force necessary to move blood through the blood vessel. Now, the third and final most common pharmaceutical intervention that we give to treat high blood pressure are calcium channel blockers. And these medications help relax the muscles of your blood vessels. Some slow your heart rate as well. So, what medications are most common to be given as calcium channel blockers? Nimodipine, amlodipine, and diltiazem, Nemotop, Norvasc, Cardizem. And these medications help us relax. Calcium channel blockers. So they block the stress, they help us relax, and slow the heart rate as well. So those are the most common types of medications we will see. Now, suppose the nurse says that your patient is taking a diuretic, then we know that they have hypertension, because we know that diuretics are most commonly used to treat patients, one of the most common medications used to treat patients with high blood pressure. But what is a side effect of a diuretic? We know that all medications have side effects, but what's the number one side effect that I need to look out for if my patient is taking a diuretic? And that main side effect would be hypokalemia, which is a fancy word for a low potassium level. Now, remember I said uh, the main side effect. So this is the main side effect that we want to know. Hypokalemia can cause muscle fatigue, weakness, leg cramps, and even problems with the heart. Make sure that the patient eats potassium-rich foods such as orange juice or bananas, or takes some type of potassium supplement. So if our patient is taking a diuretic, we know that the main side effect is a low potassium. And if they have a low potassium, then we need to make sure that something in their diet is high in potassium. And we also need to be on the lookout for weakness when we get them up. So this patient would definitely be a fall risk if they're taking a diuretic. So we want to make sure that we acknowledge these patients who are taking diuretics, who have high blood pressure, and we want to note their walking ability and the amount of assistance they may need. Our next common medication that we talked about was beta blockers. So, what is the main side effect of a beta blocker? Well, the main side effect of a patient taking a beta blocker is bradycardia. And a bradycardia is a fancy word for a low heart rate. So, if a patient is taking a beta blocker, which is our medications that end in OL, then we can expect that a main side effect would be that they may have a low heart rate. So we want to make sure that if the patient's taking beta blockers, that we have recent and consistent heart rates and blood pressure measurements on the patient. And if you're a nurse and you'll be administering this medication, of course, you know that you want to have a recent heart rate and blood pressure measurement on the patient before you administer a beta blocker. And use your judgment to decide whether it's appropriate to administer that medication, or if the blood pressure or heart rate is too low, then you want to hold off on that medication, or consult the doctor first. Also, beta blockers can cause dizziness, weakness, fatigue, and fainting are also common side effects. And we want to make sure that if a patient is taking a beta blocker, that we try to give it to them consistently and don't just stop, because it could result in a heart attack. So our main concern with patients who are taking beta blockers is the heart rate. We don't want their heart rate to drop too low, and we don't want their blood pressure to drop too low. But we know that hypotension, low blood pressure, is a common side effect of most high blood pressure medications. So the main side effect takeaway for a beta blocker is a low heart rate. And last but not least, pharmaceutical intervention for patients with high blood pressure would be a calcium channel blocker. And the main effect of a calcium channel blocker, there wasn't anything specific to calcium channel blocker, as bradycardia was to beta blockers and low potassium was to diuretic. The most common side effect, main side effect that we should look out for is low blood pressure with patients who are taking calcium channel blockers. Now, some common side effects that are consistent with calcium channel blockers include edema of the ankles as well as other extremities. And these patients sometimes have flushed skin or even dizziness. Now, do note patients taking calcium channel blockers, as you'll see here in the bottom, in between the asterisks, I wanted to draw your attention to this. Grapefruit juice and calcium channel blockers does not mix. And why doesn't this mix? Well, grapefruit juice actually contains properties that interacts with some calcium channel blockers in the stomach and increases the potency or the effect of the calcium channel blocker. So you can imagine if you have a patient who you decided to give a calcium channel blocker to, whose blood pressure was a little on the low side, but it wasn't so low that you wanted to hold the medication or consult a doctor. And this patient was drinking grapefruit juice. And so you gave this patient the calcium channel blocker, and they actually took it with grapefruit juice. And they took this drug, and the grapefruit juice increased the potency of the calcium channel blocker that you gave them, causing their blood pressure to decrease twice as much as it normally does, as you expected it to. And now you have a patient with hypotension on your hands because of the grapefruit juice. So you want to make sure that this patient does not have grapefruit and does not have grapefruit juice when they're taking their calcium channel blockers, ever. No, never. Got it? Great. Now, I know I'm talking about treating hypertension and how hypertension can lead to hypotension, and the hypotension is now too low. So now we're trying to get them back to have hypertension or high blood pressure, and it's up and it's down and it's up and it's down. It feels like a big balancing act. And in the clinical setting, it definitely will feel like a balancing act. But hypotension, because hypotension is one of the most common side effects of antihypertensive medications. And it is difficult to manage these patients' blood pressure, especially if they're new to the facility, to taking their medications. They're trying to become acquainted with maybe a change that the doctor implemented, or he switched brands. But a lot of things can affect the patient's blood pressure outside of the medication: their stress level, their emotional well-being, their physical movement, sleeping patterns, depression, anxiety. So it can be difficult to manage hypertension, but we have to attempt this balancing act. So what are some questions to ask yourself to help you make better decisions when you're trying to complete this balancing act. So I put together some questions here to share with you that I ask myself and I think would be good for you to ask yourself as well when you're caring for these patients. So the first question is, what is a realistic goal for this patient? What's their normal blood pressure? Okay. So if your patient's normal blood pressure without medications is 160, is in the 160s, then a realistic goal for them shouldn't be 100 or 105. A more realistic goal for them should be 120s or 130s. We should work to get them around there first. We shouldn't be trying to get their blood pressure as low as ours or as low as it has been, because they're going to feel the effects of that large drop in their blood pressure, and it's going to make them feel weak or fatigued. So we want to take it step by step, slow by slow, and we don't just want to change their blood pressure through medications. We want to couple the medication with a lifestyle change and let those lifestyle changes and the medications work together to get their blood pressure to the best that it can be. But we want to first set a realistic goal for the patient. Now, another question you can ask yourself is, are they having symptoms of low blood pressure? Sometimes a patient's blood pressure may drop low after you give them a hypertensive medication or they've been given one, and they may not necessarily display any symptoms associated with the low blood pressure. No confusion, no dizziness, no weakness, no complaints. They may be acting exactly like their normal self and feel that they are 100% their normal self. So, what do? Well, we let them live. We let them do what they want to do. Their blood pressure is fine. I mean, their blood pressure is low, but it's okay, and they're not experiencing any symptoms. And we want to ask them specifically, are you feeling this symptom, that symptom? Stand them up, see if they feel dizzy, and then sit them down, lay them down, and then stand them up again, just to do some orthostatic blood pressure checks with them. And then if they have no complaints after that, their blood pressure is fine, then we should just have them rest. We don't need to worry about them, and we don't need to stress ourselves out. So ask yourself, are they having symptoms? Another question, are they stressed? Did they sleep well? Did they eat or drink well? Why is their blood pressure higher or lower today? So we need to talk to them, collect some background information, ask them these questions, because, like I said, all of these things affect the patient's blood pressure, which is why it's such a balancing act to manage the patient's pressure. And another question you should ask your patient is, did they start or stop any medications recently? A lot of medications can also have effect on the cardiovascular system, as the heart is one of the most powerful, strongest muscles, and the cardiovascular system runs throughout our entire body. So it is very likely that if they started or stopped the medication or skipped the medication for the day, it could have some effect on their blood pressure. So we want to be mindful of all of these things when we are attempting such a difficult balancing act of managing a patient's blood pressure. So, while we are doing this balancing act, here are the do's and don'ts. Here are the do's and don'ts. So, a do, recheck the patient's blood pressure every 15 minutes until it rises to a normal level. This seems like a lot, but it's not. Recheck the patient's blood pressure until it's at a normal level. And remember, the normal level is defined by the patient's history of blood pressures. What's normal for this patient? And a lot of the times, the patient knows they're normal. So listen to your patient. Keep the patient seated or lying down. So if the patient's blood pressure is low and they're not complaining of any symptoms, we want to encourage them to stay seated, come back 15 minutes, 20 minutes, and check their blood pressure again, and see if it's normal. Offer them some water. Uh, do elevate the legs on the pillows to increase blood return to the heart. So if the patient's blood pressure is very low and they are feeling slightly symptomatic, then this is a trick of the trade. You can lay them down and raise their feet and send blood back to the heart, which will increase the blood pressure. And this is actually a technique that you can use, that's used when people pass out. You raise their legs, it sends blood back to the heart, which gives more blood and oxygen to the brain, and they wake up from passing out. Do offer water to increase circulating blood volume. I said that just a minute ago. Offering them water or beverage. And also check their blood sugar. If the patient has diabetes and they are experiencing symptoms of hypotension because their blood pressure was low, we also want to check their blood sugar, because if their blood sugar is low, it could be worsening the effect of the hypotension, and the hypotension and the low blood sugar can be playing off one another, making the symptoms that much worse, making this an even more dangerous situation. Some don'ts of the balancing act: don't allow the patient to stand or walk even if they deny feeling symptomatic. So we let the patient rest until their blood pressure reaches a normal level. Remember, and we define the normal level by the patient or the patient's history. Leave the patient alone. Don't leave the patient alone if their blood pressure is significantly low and they are complaining of symptoms, because they may get confused, because confusion is a side of symptom of hypotension. So they could get confused. They're very likely feeling dizzy or weak. And when they stand up because you left them alone and they want to go to the bathroom, that's when we may experience a fall. Don't bring them a large meal to eat. This is important. Just going the extra mile, this could make the difference. If the patient has a low blood pressure, don't bring them a meal to eat while they're laying snug in their bed. What will happen is, if you bring them a large meal to eat, their blood will then rush to the stomach to help digest that meal, removing all of that blood from the circulating blood volume, and their blood pressure will stay low even longer, or it may drop even more. A small snack is okay, but until their blood pressure comes back up to a normal level, I would only encourage liquids or water. And last but not least, don't forget to call the doctor and inform them. Maybe a change in the medication is needed. So if you gave the patient their normal hypertensive medications and their blood pressure dropped so low that now you are laying them flat, increasing their raising their legs on pillows and checking their blood pressure every 15 minutes, don't forget to call the doctor and inform them, hey, a change is needed. And if this isn't your patient and you're a medical assistant helping out, then you can ask the nurse, hey, would you like me to elevate the patient's legs to increase the blood return? I'm going to stay with this patient. I'm not going to leave them alone until their blood pressure is back to normal. What would you consider normal? Here was their normal blood pressures from yesterday. I think we should aim for the systolic of this and a diastolic of that. And I'm going to check the patient's blood pressure every 15 minutes until we reach that level. Um, so that would be an ideal response to this situation. So last but not least, hypertensive crisis. So, hypertensive crisis or emergency. So, the blood pressure was high and then it fell low after the hypertensive medications. And now it's so high that we're in an emergency. So, what is a hypertensive crisis? Well, this situation is an acute elevation in blood pressure that is characterized by blood pressure measurements greater than 180 over 110 millimeters of mercury. So when the systolic blood pressure gets so high that it's above 180, or the diastolic blood pressure rises so high that it's higher than 110, this patient has entered into a hypertensive crisis. And why is this so important? Well, it's so important because the blood pressure is so high that the patient might have organ failure, or they could have a stroke because there's so much force inside the blood vessels that it may burst. Uh, what should we do? We should seek help from the healthcare provider immediately, notify the doctor immediately. Well, how do we know? Maybe the patient is sitting in the lounge area, nowhere near blood pressure machine and it's nowhere near time to have their vital signs checked, or maybe they're outside having a conversation with the workers or some other residents, what are some signs and symptoms? Some signs and symptoms that your patient may be going through a hypertensive crisis would be severe chest pain or headache with confusion and blurred vision. So, headache with confusion and blurred vision. If they're feeling nauseous, just suddenly become very anxious or very short of breath, then this is why we want to the first thing we want to do is assess the patient, assess their vital signs, their heart rate, oxygen saturation, their blood sugar, and their blood pressure. And if you find that your patient's blood pressure is, let's say, 200 over 120, then you need to act quickly. Hypertensive crisis or emergency treatment would be an intravenous antihypertensive medication, something that will act very quickly. More likely than not, the doctor will order a beta blocker. If you're taking care of the patient and the patient doesn't have an IV and you see that their blood pressure is 200 over 120 and you took it twice and it was just as high, then you might want to initiate an IV on that patient, or you might want to go grab the supplies for the nurse to initiate an IV on that patient while the nurse goes in and assesses the patient after you. They will appreciate you and love you for this. Um, and notify the doctor as soon as you realize that the blood pressure is this high. And then make note of the patient's normal blood pressure and possibly have the trend of the pressure for the over the last 20 hours for the doctor as well. Now, treating high blood pressure. Non-pharmaceutical interventions. We never, ever want our patient's blood pressure to get that high. And I talked to you guys earlier about treating the patient with pharmaceutical interventions and coupling them with non-pharmaceutical interventions to reach our ideal blood pressure for the patient. So what are my top choices for non-pharmaceutical interventions, things that have been tried and true and show an actual effect on the patient's blood pressure? And those three would be exercise, stress management, and fun. So I'm going to start with fun because it's fun. We want to make sure that the patient has time to relax and to do activities that they want to do, things that they find relaxing that we may find boring or not fun at all. We want to make sure that we set time out for the patient every day to do those things and sit quietly and relax. Even if it's just for a short amount of time, we want to make sure that that patient is given the time to do them. Even if the patient doesn't do it, we want to just give them that option, because sometimes just having that option or choice or freedom can help someone relax, take a deep breath, slow down, relax their mind, and all that will have a positive effect on their blood pressure. Um, and if they don't have an activity that they like, then we can suggest one or offer some for them. So these types of fun activities would be, of course, a walk, television, cooking, playing a game or a puzzle. And I put here something that puts a smile on their face, something that makes them smile. And of course, this will lead us into stress management. Having fun can help the patient relieve stress. But what's another way to relieve stress? Well, we need to talk to our patients, help them plan their day. Maybe the patient has family coming, and there are things that they want to do slowly but surely every day in their downtime. So we want to help them plan their day and help them identify what they should do first, what are some priorities, and make sure that they don't overplan, they don't put too much on themselves, because then if they can't achieve everything that they've set out that they want to do, they'll feel stressed, and that's the exact opposite of what we want to do. We want to also focus on issues within their control. So this is, again, making sure that they're not putting too much on themselves, and help them solve those things that they've that they that are within their control. Offer them support by simply just listening. And we don't always have to have the right answer for the patient, because sometimes just listening and giving our thoughts without an answer, um, or just, repeating what they said to let them know that you heard them, but not offering any real actionable advice for them to take, can help them reduce their stress just to know that they were heard. And most important here, avoid things that upset them and trigger their stress. If they get stressed out when you ask them to choose between broccoli or carrots or going outside or watching TV, then don't ask them anymore. Just make a choice for them. And let's say maybe they're getting stressed out about taking a medication, then we want to use either changing their expectations, um, by letting them know, hey, this is something that's a part of your day. We have to work through this. Let me help you solve what it is about this medication that you don't like taking it. Is it the taste? Is it the pill's too big? Okay, I'll ask the doctor for a smaller pill, or I'll ask, can we cut it in half, or we can take our time to take the medicine, or I can mix it with something that might taste better. So these are the types of stress management. These little things can all make the difference and help shave points off of our patient's high blood pressure. Now, last but not least, old faithful, tried and true, never fails, exercise helps reduce blood pressure. How much exercise? What exercise and how much exercise? 30 minutes, 3 to 5 times a day. So start them off at 3 if the patient doesn't exercise a lot, and work them up to 5 times a day. This can lower the blood pressure by 5 to 8 millimeters of mercury. Some type of aerobic exercise. So if we're doing 3 days a week, then we should have aerobic exercise twice, which would be a walk, or maybe even 5 times a week. A short walk, 15 minutes in the morning, 15 minutes in the afternoon or evening. So that's 30 minutes of walking 5 days a week. HIT. What does HIT stand for? HIT stands for high intensity interval training. Which this defines a type of exercise which alternates between high intense activity with short light activity recovery periods of rest. So this would include making them walk really fast, walk really fast, walk really fast. And then when they get too tired to walk really fast, then we let them walk slow. Or maybe going up and down the steps, going up and down the steps, or raising their arms, doing simulated jumping jacks, just moving jumping jack, and then just moving slow. Just getting the heart rate up and then keeping the heart rate going, but not as high, not as fast. I do that maybe once to twice a week, and then strength training 2 days a week. Um, that is how I would configure a patient's exercise week. And it is important that we implement fun, stress management, and exercise into the patient's care plan to help reduce their high blood pressure and the need for pharmaceutical intervention. So, what else can we do to treat the patient's blood pressure? Their diet plays a huge issue. And the specific type of diet that patients with high blood pressure are recommended to follow is here, right on the heart. And it is a DASH diet. And that stands for Dietary Approaches to Stop Hypertension. Eating a diet that is rich in whole grains, fruits, vegetables, and low fat dairy products, and skimps on saturated fat and cholesterol can lower blood pressure by up to 11 points. So if the patient follows the DASH diet and exercises 30 minutes, 3 to 5 times a day, they can lower their blood pressure by between 16 and 19 points. 11 and then 5 to 8. So between 16 and 19 points. That's huge. So what is included in the DASH diet? The DASH diet, I have the recommended serving and products under each on each food group. So grains, dairy, vegetables, protein, fruits, and sweets. Yes, the patient can have sweets, 5 servings or fewer a week. And what is one serving? An example of a serving is 1 tablespoon of sugar, 1 tablespoon of jelly, 1 tablespoon of jam, a half a cup of sorbet, or 1 cup of lemonade. So we want to make sure that we're paying attention to what we're giving our patient as far as this sweet section and just the whole diet in general. want to not only make sure we're watching what we're giving the patient, but educate the patient about what it is that they're putting into their body and what they're being given. Now, a good way to get rid of a lot of the foods that are unhealthy for a patient's blood pressure is cutting back on any food that's processed, anything that's not a whole food. So you can see here under vegetables, we have tomatoes, carrots, broccoli, and under grains, we have bread, cereal, rice, and pasta. All of these are pretty much whole foods. No chips, no snacks, no ice creams. We have sorbet, lemonade, jelly, or jam. These are all more whole foods. No cookies, Twinkies, things like that, M&Ms. Um, Now, another big change you can make for your patient is not adding salt to any of their meals. By not adding salt, this can make a huge difference. Instead, if they want some type of flavor, use herbs or spices to add flavor. And flavor does not need, cannot doesn't just come from salt. Flavor can come from different spices. So we can call family, have them bring some different spices for the patient, or take the patient shopping, or ask the cafeteria to get some different spices for the patient and let the patient try which one they like and want to replace. And this isn't just a change that we're making for the patient for one meal, for 2 meals, for a week. This is a lifestyle change that we are getting the patient to adopt as a part of their life. Last but not least, you see here, I have eat bananas. And that's because research has shown that potassium can uh, trend down the effects of sodium on blood pressure. So if your patient absolutely refuses to stop eating salt, but will continue to exercise and not eat sweets, and they just won't let go of the salt, then we need to encourage that they eat a bit more potassium to counteract the amount of salt that they're taking in. Um, Here we have the scary truth. So, what is the scary truth? The scary truth is that strokes are very scary, and they are common amongst patients with hypertension, and common among patients with cardiovascular disease. Um, Cardiovascular disease is the leading cause of deaths around the world, and hypertension is a major risk factor for cardiovascular disease. And what happens in cardiovascular disease is the blood vessels, as I showed you in the beginning of the presentation, become damaged by the high blood pressure, and they narrow because of the plaque buildup. Remember, I talked about that big word, atherosclerosis, and all of that blocks the blood flow, which potentially can cause a stroke. Um, and now, most strokes, a large majority of strokes, are caused by narrowed or clogged blood vessels. That the ones in the brain that are very small, blood flow ceases to the brain, and that's what causes a stroke. So I just wanted to put this diagram here because a lot of patients have hypertension, and if they're not managing their hypertension well and they're running high consistently and they're older and they have other comorbidities such as diabetes that also narrow the diameter of the blood vessel, then we want to be on a lookout, unfortunately, for that patient to have a stroke. What are the symptoms of a stroke? You can always remember, act fast, because you need to act fast. Time is brain when we are caring for a patient or anticipate or caring for a patient who may have a stroke or who is having a stroke. So, what is one of the first symptoms of a stroke? Facial weakness can indicate a stroke. So if you think your patient is having a stroke for some reason, that's talking funny, they're slurring their words, or something's not right, ask them to smile. And when they smile, there will be an uneven smile. Only one side of their face will go up. Now, another symptom that a patient might be having a stroke is arms. Their arms, one of their arms or both of their arms may become weak or paralyzed or numb. So what you want to do is, if you think they're having a stroke, ask them to hold their arms out as if they're holding a pizza box with their palms up, close their eyes. If one of the arms goes down or is significantly lower than the other, then chances are that they may be having a stroke. And what may clue you into that they possibly be having a stroke first is their speech. suddenly becomes uh, you can't understand what they're saying. Suddenly becomes jumbled and garbled together, and they're looking at you because they're confused why you're not understanding them, and you're not understanding what's going on or why their speech is suddenly so slurred. And if you observe any of these symptoms, you need to act fast and let the medical doctor, nurse, whoever's in charge know immediately that you notice these symptoms on the patient, um, to save their brain cells. Because the quicker we act, the quicker we can get the patient the appropriate treatment and reduce the effects of the stroke. So here's a bit more about the scary truth of hypertension. Another diagram. So this is the amount of blood, if you will, from this diagram. Normal blood flow, pre-hypertension, you see the walls got a little thicker, and then the patient with hypertension, not a lot of blood flow at all in comparison to normal blood vessel diameter. So what other areas of the body can hypertension negatively affect? Well, we see here in this diagram a stroke, because the brain has very small blood vessels. Also, vision loss because the eyes have very small blood vessels. Heart failure, heart attack, kidney disease or failure, and also sexual dysfunction. So, we got through the scary truth about hypertension. We talked about a lot, and I'm going to test your knowledge right now with our first question because we have just about come to the end of our presentation. So I want to make sure that you grab a couple things on our way through our presentation together. So our first question, I'll read it to you. While admitting a patient, the nurse asks what medications the patient takes for hypertension. Although the patient cannot remember the name of the medication, she knows it works by reducing the workload on the heart. The nurse knows that this patient is likely referring to which medication. So this question might be tricky, but I have confidence and faith that you'll be able to figure it out. So, which medication here, and I included the brand name and the generic name, works by reducing workload on the heart? Which medication? If you chose C, you chose correct, and you are very smart. If you didn't choose C, that's okay. Like I said, this was a very difficult question. So metoprolol is a beta blocker, and we talked about how metoprolol works on the blood vessels by increasing the diameter of the blood vessel and reducing the workload on the heart. And thus the heart slows down because it doesn't have to work as hard. And metoprolol was the number one medication that we talked about in that category. Our next question. This is where you can redeem yourself. A patient called the front desk complaining of a horrible headache. The nurse responds to the call, walks over to the patient's room, and performs an assessment of the patient. Which of the following blood pressures is consistent of a patient within a hypertensive crisis? So, which blood pressure? Would it be 140 over 70, 170 over 75, 185 over 102, 190 over 111, or would it be C and D? So I kind of narrowed it down for you. So you know it's not these two. You know it's one of these three answers here. So which answer is it? 3, 2, 1. 190 over 111. Because remember, we said that for a hypertensive crisis, the patient's blood pressure had to be greater than 180 and greater than 110. And here, the blood pressure is greater than 180, but it's not greater than 110. And here, we achieve both the diastolic and systolic minimums to be considered a hypertensive crisis. So as you can see here, we made it through all of our course objectives, and we're just going to do a quick review. So we understand now, and you should be able to define hypertension, and you know how it presents. You should be able to recognize and identify hypertension by the diastolic and systolic values, as well as the patient's symptoms. And as well, we talked about even the difference between prehypertension and hypertension levels. So you should be able to pick those out in a group of blood pressure readings. Also, you should be able to recognize common hypertension medications and their side effects, which you can. We talked about the three most common classes: diuretics, beta blockers, calcium channel blockers, and I gave you some names of the three most common for each. And for beta blockers, we talked about how those medications most likely end in OLOL. You should also demonstrate knowledge on how to manage hypotension as a result of hypertensive medications. We talked about that. Remember, that was on our do's and don'ts slide, where we talked about elevating the patient's feet on a pillow. We talked about the different ways, the different things you can do: offer the patient water, not give the patient food. So little things we can do to help manage the patient with hypotension, how often we should recheck their blood pressure. And we talked about all those things. So definitely have that knowledge. You should be able to recognize the signs and symptoms of a hypertensive crisis and the recommended treatment option. Now, what was the recommended treatment option? It was to give IV antihypertensive medication. So so that would be our only option there. So we'd have to prepare the patient for that medication, or if you're a nurse, give that medication, or if you're not, prepare the equipment for the nurse to start an IV on that patient and make sure that the doctor is notified. Also, you should be able to implement non-pharmaceutical interventions. We talked about this. This is one of my favorite slides. That was one of my favorite slides. And we talked about first having fun, different ways to help the patient achieve stress management. And of course, we talked about in depth. I showed you guys a lot of information about the patient's diet, the DASH diet. And the key points in there was to include potassium with the patient's diet as a counteraction in case the patient just can't let go of the sodium, and also to limit the sweets. And we talked about using spices instead of salt. And last but not least, understanding how hypertension can lead to serious health condition, which is a stroke, and how to recognize, using our FAST acronym, the symptoms of a stroke and what we should do. So that will conclude our presentation for today. I had a great time with you spending this hour talking about hypertension and how to manage it and the effects and the medications. I hope that you were able to take a lot of great things from today's presentation and that you take them and use them to improve your practice and improve your knowledge and apply them to keep our patients safe, to keep our patients happy, and to keep our patients healthy. I want to thank you again. And on behalf of my ALF Training, my name is Deontay Marquis, and I will see you next time.